Hello, and welcome to Love Your Liver, a podcast where we talk about all things liver and give our livers just a little bit of extra love. My name is Gina Viliati Madison, aka Maya Valentine, and I'm thrilled to be here today with Dr. Karen Jerome Zapadka and two of her patients, Alyssa and Steve, who are both in very different stages of their fatty liver journey. Dr. Karen is a gastroenterology and medicine specialist with over 32 years of diverse experience, and she currently practices at Valley Gastroenterology Associates. She is affiliated with Heritage Valley Health System, where she serves on the board of directors. Dr. Karen is also on our board of directors here at Nash Knowledge, and she has been at the forefront of developing programs and partnerships to raise more awareness and provide better education to patients and healthcare providers about fatty liver disease. Dr. Karen has also been named a 2021 Pittsburgh Magazine Top Doctor, and she is pursuing certification through the Society of Metabolic Health Practitioners. And she serves as a co-chair on the Fatty Liver Coalition through the Community Liver Alliance and Nash Knowledge. She has implemented a comprehensive obesity program in her practice. She has developed a multidisciplinary nutrition committee through Heritage Valley and took a lead role in a pediatric symposium, an event to raise awareness of pediatric liver disease. So welcome, all of you.
Thank you.
Thank you. I'm so excited to have you all here today so that we can really show our audience some of the different stages of metabolic disease, metabolic syndrome, and fatty liver disease. And Dr. Karen, really happy and excited to have you. You're such a valued member of our board at Nash Knowledge. And your journey, the work you do in the field is just so inspiring. So as we get started, maybe you can just talk a little bit about kind of your interest and your passion around, this disease and helping patients and your journey that kind of led you here.
Thank you. Very happy to be here. We have to say that I did all of my training at the University of Pittsburgh, and part of that training was through the liver transplant service. So we did a lot of work with patients in the midst of being evaluated for liver transplantations. We saw a lot of end-stage liver disease, and at that point, it was more disease management, and there really wasn't ever much discussion about preventing liver disease. It was all end-stage liver disease. So when I got out into practice, we started obviously seeing patients at earlier stages of various types of liver disease. And in the beginning of my practice, I was very interested in what we used to call obesity-related medical problems, particularly because of the fatty liver disease. And especially so many of these patients were at risk for cancers. And a lot of the cancers were GI tract cancers, colon, esophageal, pancreatic, that type of thing. And I've been speaking in the community since the early 2000s about all of these different issues, but I never really had a full grasp of what it meant. Why did people develop these diseases when other people would not? So I think, we've always talked about, Gina, what happened in my career that really spurred me on to develop more knowledge about this. And I think two things really came to mind. The first was my neighbor took me years ago to an event at Geneva College called the Faux Food Movement, FAUX, Fake Food Movement. And the biggest thing at that meeting was they challenged you to go home and look in your cupboards and examine every ingredient of every boxed food in your cupboard. And my children were young at the time, and I looked at these ingredients and we still laugh. All my children laugh. That was the day Mom threw out the fruit roll-ups and the Gushers, because you looked at these labels, you thought, what am I feeding my children? And I think that was what first raised my consciousness about, what is in all of these foods that we're eating. And then the second event was a patient that I always call Mary. I use her in all of my talks. It's a woman that we were asked to see with end-stage liver disease and an unresectable, what's called a hepatoma, a liver tumor. And we went to see her, and she had all of the classic features of metabolic syndrome, what we now call insulin resistance syndrome. The central obesity, the diabetes, the hypertension, the heart disease, the fatty liver. And here she was with this end-stage unresectable tumor. Early 70s, when she should have been out living life, enjoying her family, traveling the world. And she has this unresectable liver tumor. And when we spoke at length about her fatty liver, she looked up at me from her hospital bed and she said, "Doctor, did I eat myself to death?" And I left that encounter so demoralized and very distraught and just really questioning, what am I doing as a physician? how could I possibly be helping people if they end up like Mary? And at that point, I really didn't know what to tell her. Yes, you probably did eat yourself to death, but what was it about the eating specifically? What was it? And so I got back to my office, and my nurse manager at the time handed me this article, said, Dr. Z, you need to do this. And it was an article talking about the obesity medicine certification that was brand new at the time. This was back in 2014 or so. And I went to my first meeting about obesity medicine, and I was hooked. I mean, I came home from that meeting and I told my husband, this is something that I really have to do. So I got my certification with that, and that led to the Society of Metabolic Health Practitioners that really opened up my eyes to nutrition as far as therapeutic carbohydrate reduction, the harms of all of the processed foods, the processed seed oils. And it was really then that things began to mesh for me, and I really began to understand how nutrition was playing a role in what we now call metabolic madness, all of the metabolic diseases that we see, of which, fatty liver is the largest one that I see personally. And so we developed a comprehensive program for our obesity medicine patients, our fatty liver patients. We have a dietitian that works with me side by side. We can talk about some of the things that we're doing with that program. But that's been my metamorphosis. And I finally, after nearly 30 years of being a physician, feel like I get it. And I truly understand what to advise and counsel my patients on.
And I know when my family and I met you, it was probably less than 5 years after 2014. And one of the things that I think we really connected on was your passion and the way that you really are so educated around, this issue that we have and understanding the nutrition aspect. Because for my dad, hearing you speak about that, your patient Mary is a very similar story to my father. He was just very, very fortunate that his was caught at a point where he was able to actually get a transplant. It was before he really reached that dire state. But if we would have known then what we know now, he probably wouldn't have even needed his transplant. And, I know you talk a lot about kind of this, the cornerstones of care and this holistic approach to care and how you really, think about that patient care and treatment. So maybe talk about how you, really handle that and how this experience and all of your education and knowledge has kind of led you to transforming the way you think about how you care for patients.
Mm-hmm. I mean, I'll give you a perfect example. My son is a student to become a nurse practitioner. And he rotated with me yesterday. And I said, this is the perfect day because we saw 3 patients actually that had every component of the metabolic syndrome, the insulin resistance syndrome, the fatty liver, the high triglycerides, the central obesity, the hypertension. A couple of them already had coronary artery disease. So really the full-fledged syndrome. And all 3 of them, with the work that we were doing with them as far as the right type of nutrition, the right type of physical activity, the behavioral changes that we're making, have totally reversed so many components of their metabolic syndrome. And it was wonderful to show my son, this works. And I think that within the office, we talk about this cornerstones of care. We talk about the medical issues, the nutrition, the physical activity, and the behavioral at every visit. And we touch upon each of those and make sure that they are following the advice that we have been giving them. And I know, Gina, we always talk about this, the whole concept of hope, giving the patients hope. And when I meet with them for the first time and I see that what they have could truly be reversible, that's how I leave it with them. If you do what I ask you to do, and we do this together over the next several months, I guarantee you we will get this turned around. And so we always want to leave them with hope that we're going to be able to improve their health.
No, I think that's such a great message. And I think Steve is a living example of a patient who you gave that hope to. And he followed the suggestions and the path and the plan that you had for him. And recently, his lab work and his fiber scan was normal. He had improved metabolic markers as well. So Steve, maybe talk a little bit about, your fatty liver journey. I know you mentioned the other day that it was a little overwhelming. You didn't know where to start. So maybe talk just a little bit about that and your relationship with Dr. Karen and how the plan she gave you helped give you some direction and, where you were then versus where you are now.
Well, yes, she did talk to me, and that helped a lot. It was a complete picture of the metabolic and foods to eat and not to eat, what was wrong with the bad foods. And after a couple of visits, it finally sunk in that the alternative was not very good. So she talked about foods, what I should be eating, like I said before, that suggested some books, which was kind of overwhelming. But, you start on it, and after a while, you start feeling a little bit better. The weight drops off. You start reading labels, because my diet prior to that was a train wreck, actually, thinking back. And as time goes on, it does get easier. I think your taste buds change too with those recommendations. And you start thinking about the foods. Like I said, I just came back from the beach, and you go to a restaurant and, the foods on the menus are kind of bad, but I was eating salads and you can get fish on the salads. It's not like you're really missing anything out. I don't eat too many desserts now anymore, but I was satisfied. It's out there. It's out there in the restaurant. You can find your way through it. I'm pretty well happy where I'm at. All the numbers are ticking up and are getting better, and I don't feel like I'm missing out on anything. I really don't. Like I said before, fast foods was nothing. That was just something you went to a couple times a week, and we rarely go out to eat, fast foods anymore.
And I think your story and just what you just said about food is so common with so many people. And I think there are so many people that struggle with these issues. And that's part of the reason why at Nash Knowledge, we're launching today our Thanksgiving in June initiative that really is the start of a year-long focus on family health and really centered around diet and nutrition and educating and raising awareness around that. And also the physical activity piece as well. But again, I think what's so great about your story is you're seeing that improvement. And you even mentioned that, the cravings for like the foods that are bad kind of go away. And you've learned and educated yourself through, some coaching on how to even eat healthier when you are out. And, eating out is your only option. That doesn't mean you have to go for that, big juicy burger and fries. There's still healthier options that you can have. So there is, really hope out there. And it's such a common issue, but you are able to make changes. And I think that's an important message for folks who are newer in this journey, which brings us to Alyssa, because Alyssa, I know you're really, earlier in your journey here. And I know you even mentioned a little bit that you were bummed to find out about the fatty liver disease and that you do a lot of making sure that you really are planning your meals and scheduling. So maybe just talk about your experience in your journey so far as well.
Yeah, definitely. So I had first found out about my fatty liver disease when I was 18 and kind of didn't really understand the severity of the situation and went about 2 years not really knowing anything, not really changing my lifestyle around until I had to have my gallbladder removed. And upon that surgery, I was told, your liver is so surrounded with fat, we almost couldn't get your gallbladder out. We're referring you to a specialist. In my case, it was Dr. Sapatka, and we're going to, have to reconsult about your fatty liver disease and make the necessary changes, to try and get you healthier. And as a fresh 21-year-old, I was really shocked to hear that I have fatty liver disease at that severity, especially since I see all my friends, they're new to the bar life. They want to go out. They want to have fun. I'm in college. So it's definitely like a different lifestyle that I kind of am just living parallel along them. I mean, I'm in a busy lifestyle. I'm in a sorority. I'm involved in, I think, maybe 4 or 5 other organizations on campus as well. And being a full-time student while also working a full-time job is not easy. So I found myself, picking up fast food on the go here and there a lot. And that's when I'm like, Alyssa, you need to start considering your health and your future, because I do not want to end up on the liver transplant list. I definitely want like a sustainable and long living life where I get to enjoy myself and like hopefully a future family and get to watch my kids grow up. I don't, want to be the one person that has to, waver the fact like, when is my liver going to go? So with the help of Dr. Zapatka and a dietitian, Lisa, at Valley Gastro, I'm working on the low carb diet and definitely cutting out those processed foods, going back to the basics and just meal prepping and schedule planning is one of the major things that saves me a lot of time, like knowing when I have free time between my busy schedule to meal prep and to prepare for like what's coming up in the next week or so I can account for that appropriately, whether it be like have a meal ready for when I'm on campus and I know I'm going to be there for a long day and I need a snack instead of going to the nearest fast food restaurant like a Wendy's or a McDonald's that happens to be on campus and is readily available for all of the college students. It saves me time in that sense. It's actually saving me money instead of going out and buying all of this fast food every single week or a couple days a week. And I just feel a lot better as someone with IBS and no gallbladder. I mean, my entire gastrointestinal tract is a mess as it is. And eating simpler and healthier foods just makes me feel better and allows me to like do more in my everyday life.
That's great. And I think you're another message of hope that even though you're a little bit earlier on and you're at a younger stage, showing the different faces of this disease and the different stages of the disease. So Dr. Karen, maybe you can talk a little bit. So we hit on nutrition, but I'd like you to maybe just go a little bit deeper about processed foods versus real foods and that impact on, the overall health and omega-6 fatty acids and sugar. And just, I think there's a lot of confusion out there. We said it's madness, right? There's a lot that patients have to really sort through. So maybe you can help talk through that a little.
Absolutely. So, I think it's really important to understand that really around 1980 or so, we really had a huge transformation in the way that we eat in this country and now worldwide. And a lot of people refer to it as the shift. Pre-1980, we ate real food. And I think for those of us that are older, I was a teenager then, my early 20s. I can remember this shift. I remember when the first fast food restaurants came to our area. But growing up, we just didn't have that. We ate real food, and a lot of it was from local farms, local meat, local vegetables. And we didn't have we had a few processed types of things, but mostly it was real food. Certainly sugar was coming into play, no question. Kool-Aid and that type of thing. But really, from the 1980s on, we've had this tremendous shift where we've gone from eating this real food to a lot of packaged processed foods. And when you think about what has been taken away from them as they've been ultra processed, would be a lot of the fiber, because fiber, you have to get rid of that to prolong shelf lives. So a lot of these packaged foods don't have fiber, which is good for gut health. And then a lot of them, we've had a transformation in the types of fats that we're eating. We used to eat saturated animal fats pre-1980s, way back even longer. And now if you look at the labels, almost every processed food has a fat in it, but it is a processed seed oil. It's an omega-6 oil that we used to get in very small amounts, and now we're getting in tremendous amounts. And those interfere with our metabolic health and can lead to insulin resistance at the level of fat cells, can be pro-inflammatory, can be incorporated into cell membranes to reduce their function. So I think they have a whole host of roles that these omega-6 fatty acids are playing, and you cannot pick up a boxed packaged food that does not have that in there. And then obviously the biggie is the added sugar, and we talk about that all of the time. And I think sugar, when we think about sugar, we think of it as being both glucose and fructose, and they both play a different role. Glucose by way of raising insulin levels, and we can talk about that later. What does this elevated insulin level lead to? It's something we're not talking enough about. And then obviously the fructose has its own unique role, particularly in the liver where it is metabolized. And fructose can go down many different pathways, all of them leading to insulin resistance of the liver and the metabolic syndrome, all of the components of the metabolic syndrome. And so now we have where we may have just been eating a few teaspoons of sugar before. Some of the statistics as far as kids, 22 to 30 teaspoons of sugar a day. And if you think, I tell the patients, think about your bloodstream. Your bloodstream has 1 teaspoon of sugar in it, and you're eating 22 to 30 teaspoons of sugar a day. Where is that going in your body? How is your body processing that? And so, again, it's leading to this metabolic madness, as we call it, and all of the components of the metabolic syndrome, which for people who, I think we talked about it earlier, it's the central obesity, it's high blood pressure, it's high triglycerides, it's low HDL, it's risks for coronary artery disease, progressing on to diabetes. And then the center of all of this is insulin resistance, which really is at the root cause of almost all of the non-infectious diseases that we're seeing now.
So maybe talk about the insulin resistance a little bit, because as you mentioned, I think that's becoming something that is not talked about enough. Folks are starting to talk about it, but it needs to be out there more.
So insulin resistance is a very complex process. It's different in individual patients, and it can vary organ by organ. There's a lot of research attempting to define its organ of origin, and it may be the fat cells in the periphery or intra-abdominally. It certainly is occurring in the liver and the area of the muscle, and it's a very complex process. As we know, insulin is a hormone made by the pancreas in response to the foods that we eat. And we know that the foods that raise the insulin the highest are starches and sugars, carbohydrates and sugars. So we typically think of insulin in response to food in the context of controlling blood sugars. When we eat a carbohydrate or sugar, insulin is secreted and helps us to move that blood sugar into various tissues to be used. But we need to understand that all cells of the body have insulin receptors, and that insulin is a signal for that cell to perform the action that's unique to that organ. So as the cells become resistant to the effects of insulin, we don't just develop diabetes, but we develop dysfunction throughout all of the organ systems of the body. And as these cells become dysfunctional and are not working well, this causes the pancreas to secrete even more insulin to get all of the tissues of these organs to do their functions. So we have to understand that if we have insulin resistance, that goes hand in hand with a high insulin level. We can't talk about insulin resistance without talking about high insulin levels, what we call hyperinsulinemia. So looking at the liver, we know that when the liver becomes insulin resistant, it does not respond to the effects of insulin. And two major things happen. The first is that the liver begins to turn excess carbohydrates into fat, a process called de novo lipogenesis, new fat making. And this promotes the development of fatty liver. But the other part of the picture that I really didn't have a clear understanding of until the past few years is that as the liver becomes insulin resistant, it also begins to secrete more and more glucose that's being made by the liver into the bloodstream, raising the blood sugar level and really driving the onset of diabetes. So two major functions that happen in the liver when the liver is insulin resistant. And I talk to my patients, if you have fatty liver, your liver's insulin resistant. So we can also, when we think about this hyperinsulinemia, this high insulin level, this high insulin level can affect a multitude of organs. At the level of the kidney, it can cause changes that can promote high blood pressure. At the level of the ovaries, the high insulin level can promote polycystic ovary disease and infertility. There's even concern now that high insulin levels and insulin resistance at the level of the brain are contributing to our rising rates of dementia. And so, multiple different organ systems can be harmed by both insulin resistance and high insulin levels. The other issues that high insulin levels can cause, we have a hormone called leptin that's made by our fat cells. That leptin goes to our brain and tells our brain that we are not hungry anymore. Well, leptin blocks that signal. So when people are insulin resistant and have hyperinsulinemia, they are always hungry. This certainly contributes to that. I think the biggest thing that I talk to patients about as far as high insulin levels is that it has an effect on fat cells. And so insulin promotes extra energy being put into fat cells as fat, but insulin also blocks the mechanism that allows us to burn that fat. And so as long as you have extra insulin in your system, you are not going to be able to burn body fat. And there are certain studies that certainly show that high insulin levels as an adolescent highly predict the development of obesity as an adult.
Now, I think that's such a great explanation so that we can really understand what's happening in the body. And, we talk a lot about the impact of the food you eat and how that really impacts so many different organs and so many different aspects of health.
Absolutely. And I think the other unfortunate thing, and there are a few papers that I've looked at recently that clearly show that we can put patients on multiple medications to treat the diseases that are either brought about or contributed to by insulin resistance and high insulin levels. They may help the symptoms, but they do nothing to treat the insulin resistance and hyperinsulinemia. And so we need to begin to think about these lifestyle changes as ones that will improve insulin resistance, lower insulin levels, and improve insulin sensitivity. And first and foremost, as we've talked about, are the changes in nutrition with therapeutic carbohydrate reduction, weaning off of starches and sugars, and reducing the processed seed oils. All of those certainly would contribute to improvement in insulin sensitivity. And we also know that physical activity, especially resistance training, improves insulin sensitivity. I did want to mention that there is a new book by the name of researcher Ben Bickman, who's considered an authority on insulin resistance. The name of the book is Why We Get Sick. And it's written for the lay public, though as a physician, I certainly learned a great deal from it. Also, Dr. Robert Lustig's book, Fat Chance. And there's another new book out called Eat Well or Die Slowly. And certainly all the research of Jeff Volek and Steve Phinney looking at therapeutic carbohydrate reduction. All of these are within the context of looking at improvements in insulin resistance, insulin sensitivity, metabolic markers by reducing and changing our nutrition, as we've talked about.
So I think that's great that there's so many out there who are doing a lot of research and really getting the data and helping us understand in layman's terms in the general public how, our foods and nutrition really do impact so many different areas of the body. And I thought you did a great job really talking about insulin and insulin resistance so that we can really understand what is happening and how that affects our body overall.
Absolutely. And I think the last point that I'd like to make about this is that if you are thin and think you're safe, think again, because the estimates are that close to 40% of normal weight people have some component of the metabolic syndrome and insulin resistance. And I share my story with my patients that I have been thin all my life. I have exercised all of my life, yet I got a lipid panel several years ago where my triglycerides were very high at 189 and my HDL was borderline at 50. That ratio of triglyceride to HDL of over 3 is consistent with insulin resistance. And I was shocked. How could I be insulin resistant? Thankfully, I understood what to do. I weaned myself off of all processed foods. I reduced my carbohydrates, and within 6 months, my triglycerides went from 189 to 39, and my HDL, what some people call good cholesterol, went from 50 to 89 without any weight loss or change in exercise at all. Again, getting back to Dr. Volek's work that shows that even without weight loss, a change in nutrition can affect all metabolic markers. So with our fatty liver patients, even though depending upon their stage, we will usually recommend at minimum a 5 to 10 and hopefully a 10% weight loss, I also stress with them that even if we can't achieve that weight loss immediately, just changing their nutrition and physical activity will have huge impacts on their metabolic health.
Yeah, no, and I think that's so great that you're mentioning that too, because today is the kickoff of our Nash Knowledge Thanksgiving in June. And everything you just spoke about is really what we're centered around, is understanding, it's not about that outward appearance, it's about the inside and understanding what you're putting in your body and how it affects your health. And that also sometimes just small steps You may not see the results right away, but over time, when you stay committed, you'll start to feel a lot healthier. Your health will improve. And it all is centered around making sure you're eating a fresher diet, getting rid of those processed foods, the refined sugars, drinking more water and less sugary drinks, getting more physically active. And I love the Be Well Nation resistance program that you partner with as well, because I think that's a great aspect, because some people don't want to be out there running or jogging. So just finding what works for you and, changing your lifestyle just kind of one step at a time.
As clinicians, we've been very focused on the blood sugar. And when the blood sugar starts to raise, we call that pre-diabetes or impaired glucose. And then when it gets to even a higher range, we call that diabetes. But what we have to understand, and I've only just in the past few years gained such an appreciation, is by the time we're pre-diabetic, we have been insulin resistant and hyperinsulinemic for years, probably well over a decade. And so if we wait until someone's pre-diabetic and all of a sudden decide to intervene, we've lost a decade of that patient's life where they have been insulin resistant for years. And so I think as clinicians, we need to start looking at it like that, to start looking for clues early on. Because we know if someone has very early insulin resistance and even pre-diabetes as well, we can very easily get that turned around with the types of lifestyle changes that we're doing in our practice, as far as the nutrition and the physical activity and the sleep and the chronic stress management. We know that we can very easily get that turned around. The 3 patients that we saw yesterday are perfect examples, and they had advanced disease. And we've gotten it all turned around with the right lifestyle changes.
I think one of the great things that I love about your practice and what you're really doing, and I hit on this a little bit earlier, is really looking at that full health approach, that whole, total body health, and also the collaboration through different specialties as well to really look at that patient. So you talked a little bit about like the nutrition, you hit a little bit on the behavioral, the medical, there's the physical as well. I know you have a great resistance training program through Be Well Nation for patients too. So maybe just talk about kind of that overall approach and how what you're seeing through that. Obviously, you've had some great success. So maybe just talk a little bit about that.
Oh, absolutely. I mean, it's our pride and joy. Lisa's my dietitian, and I've actually known her for years. I went to her because I thought she would be amenable to some of the things that we're trying to do. And we, in the beginning, tried, strict low-calorie diets, meal replacement types of things. People were hungry constantly. And if you cannot control hunger, you're never going to be able to get someone to lose weight when they're always hungry. And so we really started digging into the science of carbohydrate reduction, therapeutic carbohydrate reduction. And we looked at the research of David Ludwig, particularly the research of Jeff Volek from Ohio State, who's done some amazing research on carbohydrate reduction and ketogenic diets, clearly showing that without any weight loss at all, you can have improvement in all of your metabolic parameters, even without any weight loss at all. And so we came to realize that, carbohydrate reduction has been the most studied eating pattern of all. And we knew that these patients that we were seeing clearly had metabolic syndrome and insulin resistance. So it made sense to us, based upon the science, to move in a direction of doing carbohydrate reduction. And so we basically have 2 wings of our practice where we do. One wing of it is called phase 1, where it's 25% carbohydrates, 25% protein, and 50% healthy fats. And that's been working out well. But if someone really if someone's diabetic, they really want to try to get it turned around, very insulin resistant, if they want to move forward with a well-formulated ketogenic meal plan, we are able to do that as well. And the Society of Metabolic Health Practitioners has actually come out with the first set of clinical guidelines that has helped us. And the other organization is Diet Doctors. And they are a carbohydrate reduction group as well. And they've a whole host of education pieces for physicians and practitioners who want to start implementing this in their practice. So that the information is there if anyone would want to start doing this. It's finding a dietitian who's willing to do that with you. And so I have Lisa, who's been a wonderful asset, working with the patients, seeing them back frequently and really working with them. And Steve, I had to laugh because I thought of Lisa, one of our biggest lessons with the patient is, how do you go out to a restaurant and order and not have it sabotage all of the good work that you've done all week. And so that is a huge lesson that we teach patients. How do you get out there and order a meal in a restaurant and still enjoy yourself and feel like you had a nice meal? And it's very, very possible. So that's the nutrition end of things. Obviously, the medical end of things we talked about. The physical activity end of things, this is another thing that we couldn't be more proud of. We have an alliance with Be Well Nation. Leslie Benedetto and Chris Koski, the two exercise specialists at Be Well Nation. It's a local health club near us. We've worked with them for years within the fatty liver sphere, and they wrote this workshop for our patients, specifically for our patients, our obesity patients and our fatty liver patients. It's a 3-hour workshop. They teach them a total body resistance workout that they can then take the resistance bands home with them and do this program at home 2 to 3 days a week. And they can touch bases with Be Well Nation. They can join Be Well Nation if they want, but it really hit that resistance training that is so crucial to improving insulin sensitivity. We know that it can mobilize fat out of the liver. It can improve diabetes, all of the metabolic markers, and keeps patients strong. And so that's been a wonderful collaboration with Be Well Nation. And then we have the behavioral, which is a lot of motivational interviewing. We screen patients for depression, for processed food addiction. We're beginning to form a referral basis to Dr. Joan Iflin, who is an expert on processed food addictions, and she has an online resource for patients to join. I have to say, we're looking for local therapists that could maybe do some cognitive behavioral therapy with eating issues, but they're hard to find. I think that's a real need. But those are the cornerstones. And so every time we see the patient, we touch on each of those issues at every visit to make sure that they're on track and to make sure that they're not struggling and where do they need the help.
No, I think that's great. And that's, again, with our Thanksgiving in June initiative and our family health initiative, a lot of this really stems, it starts in the home. It starts as a family. How do you, kind of get together as a family and cook these healthy meals? And when you go out to a restaurant, making sure that you're making those correct decisions from the physical aspect. Even if you think about food addiction, I know, like for me and my family personally, I grew up Italian. We, a lot of what we did, our life was like centered around food. So how do we start kind of changing that mindset and think about it differently? It's not that food's bad. It's the types of food and how you think about it as well. So I think that's such an important, the way that you're really thinking about that total, full body health, again, that I had mentioned. Going back to Alyssa and Steve, I'll go to you first, Alyssa. Were you kind of surprised at kind of how the liver impacts all these different areas of your health and how you need to, it's not just about kind of the food alone, but thinking about it a little bit more holistically?
Yeah, definitely. So at first I knew nothing about the liver or really where it was at. So I learned that quite quickly, but to just understand how much it controls and can affect your overall health and just the way you feel on a daily basis was really surprising to me. And I am very early on in my recovery of my liver, so I can't contest to much, but I will say just in a little bit of what I've done, because I have done at-home resistance training. I've been changing my diet. I go to the gym 3 to 5 days a week, try and do cardio there. So I'm trying to stay as active as possible, but it's definitely just kind of enlightened me in a sense. Overall, I just feel like I have a new lifestyle to look forward to and just stay motivated with every day. And I think that's definitely kind of relates to what Dr. Zapatka said about them just giving you hope that there is, changes and there's a way to make yourself feel better every day.
And Steve, what about you? You're a little bit further along. You're in the stage where you're seeing this improvements. You've been working this for a long time. Maybe just talk a little bit again about your liver health, and did you have to educate yourself on how the liver impacts, other areas of your body and the nutrition aspect as well?
Yeah, that was explained to me in those terms from Dr. Zapatka. But yeah, I mean, it's been about 2 years and I go to the gym about 5 days a week. I've gone basically back to basics. Like Dr. Zapatka said, when I was growing up, most of that stuff was farm-raised food. And I even talked with my wife. We didn't have that stuff on the counter, all the cookies and candies and stuff that they've got now. It's so easy reach for kids today. We didn't have that growing up. And I've gotten back out of it. We've gone back to basic foods, cooked from scratch. And even my wife, she goes to therapist, Lisa, and she's herself, and it's been a short time. She's lost 17 pounds.
Wow, that's great.
And she was there for insulin resistance, and we really don't have a problem with it anymore. It's just something that we're satisfied with the food, even though her mother's Italian, and it's always have another plate, have another plate, have another plate.
Yes.
And I don't eat to fullness anymore.
Yes.
I would eat more that you can't even move after you take a nap. You're just so stuffed. And I just don't do it, and we just don't do it anymore. Even my daughter, she works 12-hour shifts at a med center. They'd always eat out. They'd always have food brought in, and now she preps her food and takes it with her. It's basic because she was tired of just feeling bad. So it does work, and it doesn't take a whole lot of time before you see the results.
And I think that's a great message too, that, your own experience and how that's impacted, your wife, your daughter, and going back to the, family. And it's not just family, it's family, friends, it's the environment. And the more folks that become educated and understand how much better you feel when you go back to the basics, which I think is such a critical message there, it's just so important to your overall health. And it seems very daunting. I think that's why there's so many fad diets out there. It's not just daunting to do because it seems like it's going to be hard. It's confusing because there's so many mixed messages out there. But I think when you really get to the root of it and understand it, and you start to make small changes, those small changes start to become bigger changes and bigger changes. And over time, you're seeing that improvement in your health. And we all want to be healthy. We just went through COVID and, experienced one of the worst times globally, with that, and understanding just how important our health is. And I think to me, that's such a critical message to get out to folks is, that should have been a wake up call about just the importance of health in general. And now let's kind of get back on track. Let's kind of take back control, and let's start with, our own health and get that out there to our family health as well, and go back to the basics. So Dr. Karen, I'd like to give you opportunity to just speak a little bit more kind of around just all of this.
Well, you raised a very interesting point about COVID. When you think about, what were the risk factors for severe COVID? Certainly one of them was someone who did not have metabolic good health. And, one of the things that we're using in one of our recent talks is the latest, they call it the NHANES study, the National Health Survey of this country, that clearly showed that only 12% of the country is metabolically healthy. When you check off the boxes for, central obesity, triglycerides being elevated, blood sugar being elevated, blood pressure being elevated, HDL being low, only 12% of people in this country are metabolically healthy. And we certainly know that people at risk for severe COVID were the people that were not metabolically healthy. That's 88% of the population now, which is just staggering. And the statistics now about pre-diabetes, probably 50% of the country's pre-diabetic. So these are staggering statistics, frightening statistics. And I know even in our own practice, we do that fibro scan, that scan that looks at the liver every Friday. We spend a day doing those. And it is just so concerning when you're looking at these reports and you see how many people walk in thinking that they're healthy and are, called that day or later that next week to tell them that they have severe fatty liver, some advanced already. And these are people in their 40s and 50s, and it's pretty frightening statistics. So we, think at our healthcare facility, I know you mentioned that we started this multidisciplinary nutrition committee. COVID put that on hold. But I do have a core group of physicians that are ready to get started with this again. I think we're going to meet in the fall to allow us time to review all the up-to-date literature, particularly with regard to nutrition. And we are ready to tackle this as a healthcare system. We need to tackle this. We need to get this information out to people on a much bigger level than what my small practice can do. But I think what we've started our practice is we've shown that we can do this. If we get the patients the right support, those cornerstones of care, we know that we can do this. Now we just have to figure out how can we roll this out to our entire network, our Heritage Valley Health System. I think that's what's next. How could we make this work across the healthcare system? But again, it's doing these events, it's do all these speaking engagements that you and I do together, getting the word out, opening people's minds, getting their eyes opened, getting them reading labels, understanding what food is doing to us, both good and bad. How is it affecting us? Education.
There's probably days where you probably wonder, how can I keep going? Seeing this continue to rise and not always getting the attention that it deserves. People know that they have a heart issue. They take that seriously right away. And it's well known. And so it's kind of climbing this uphill battle while the hill is continuing to grow and grow. The hill's growing and getting steeper. Mm-hmm. So how do you personally kind of continue to trudge through, I guess?
It's so funny. I thank my patients. I mean, Steve and Alyssa, oh my gosh, I told them the other day, they give me the motivation to keep going. The 2 or 3 patients that I saw yesterday, I mean, one of them had a history of colon cancer and every component of the metabolic syndrome. And he has turned everything around. He's only in his late 50s, early 60s. I mean, he will live a long, healthy life, most likely, because of all the changes that he's made. That's what motivates me when I see that people listen and want to get things turned around, do what you ask them to do. And it's so rewarding. That's what keeps me going. No question. Seeing that these patients are out there, they want the help.
And like you said earlier, and there's hope, delivering that message of hope to patients, which you clearly do. You're clearly very inspiring and deliver that hope to patients, which then seeing the results, as you just said, I'm sure helps drive you. So I think that's a great note to end on. But before we end, I do want to ask if there's anything that we've missed, any critical points or anything you just really would love to reiterate.
Well, just one thing from a nutrition standpoint that I didn't mention, we talked about everything but protein. And I think a lot of the studies clearly show, particularly young women and middle-aged women are not getting enough protein. And when I see patients and I just say, go through your day, tell me what you eat for breakfast, for lunch, for dinner. And it's clear, and I do this with so many patients, and it's clear to me that that is true, that people are just not getting enough protein. So more recently, Lisa and I have really made a push to really calculate out their protein needs, probably much higher than what we were doing in the beginning as more information becomes available, and really stressing that along the way. We need that protein. That's a pretty important factor as far as the nutrition as well.
Well, thank you. I want to thank you all so much for your time today. I also just again want to give another plug for our Thanksgiving in June initiative, which kicks off today. We in Nash Knowledge created another website, which is www.love-your-liver.org. And we have some great tips and tools on there surrounded around these cornerstones of care that we already talked about, talking about what you eat, what you drink, what you do, and how you think. And we would love for you to get involved, go out with your family, maybe have a healthy family picnic for our Thanksgiving in June, get some physical activity together, maybe do some, small acts of kindness. We are actually donating 100 meals to a women's shelter on behalf of Nash Knowledge in collaboration with our partners at Case Specific Nutrition and Case Specific Meal Prep. So we're really excited that we're going to be doing that this week. We also have been working with some local Girl Scout troops, and we're going to be delivering some thank you cards and, some gratitude to our medical heroes, our healthcare professionals who helped us not just get through COVID, but are there for us every single day and kind of along the way with our health. So just want to encourage everyone to live a healthier lifestyle, get together, do it as a family. So with that, again, this is another episode of Love Your Liver, where we talk about all things liver and give our livers just a little bit of extra love. I want to thank you all for joining today. And again, a special thanks to our guests. So thank you and have a great and wonderful day.